Well, it's been a huge focus of attention over the past few months. From the highest levels of government to family living rooms, everyone has been talking about what will happen as kids head back to school. Well, now it is happening. Dr. Janet DeMille is Medical Officer of Health with the Thunder Bay District Health Unit, and she's on the line for an update. Dr. DeMille, good morning.
Good morning, Amy.
So kids are back in those classrooms. I wonder if you could tell me a little bit about what communication is like right now between the health unit and schools.
It's very, very intense, I would say. There's lots of back and forth. This has been going on for, a couple of weeks, if not more, about implementing the guidance that was provided by the government. The initial guidance came out at the end of July, and we had other materials coming down, and the expectations for schools and school boards to implement. And, we've always worked with schools. We have a healthy schools team, which we've recently sort of enhanced with some of the additional public health nurses, and we have infectious disease specialists and our public health inspectors who are all involved in really being able to support the return to school, and of course the schools implementing all the measures that will help keep kids and teachers and other staff and anybody in the school setting safe.
What kind of role are public health nurses playing?
So we have public health nurses are assigned to individual schools, and we're still sort of onboarding and these nurses and building that capacity. But we've always had nurses directly assigned to particular schools, and they're reaching out and to talk to the principals and really helping them kind of answering the questions that they have and helping them implement the guidance. And the nurses were also preparing, of course, for the possibility and, in fact, the likelihood that, there could be COVID-19, somebody with COVID-19 in the school setting, and supporting the schools in how to manage that, but also, how are we going to work together in managing that particular situation.
Mm-hmm. And I know that earlier you were waiting for more guidance from the province about that, but what do we know now about what will happen if there's a child who's doing in-class learning who either has symptoms or tests positive? What happens?
Yeah, so certainly anybody who has symptoms, I'll note the real importance that, if a child has symptoms when they're at home, they should not go to school. So it is important that parents and caregivers really do that, the screening of their child before they leave for school, or they take the school bus or go to a daycare, for example, that they screen the child and keep the child home if they have any symptoms. So that's really important in order to keep somebody out of the school who might have COVID. But if somebody does develop, symptoms while they're at school, there is a process in place. The school needs to sort of isolate that person in a special room and provide them a medical mask to wear and tissues if they're coughing or sneezing, and they'll call the parent and or caregiver and expect that child be picked up. So there's where we've put that in place and provided schools guidance on that. And anybody who has symptoms, it's recommended that they get tested so they can call their local assessment center to arrange for that testing. If somebody is actually positive, then that's where public health really, kicks in to do our usual case and contact management, what we call that. So following up, we'll follow up with the schools. We have ways of reaching the schools even like on the weekends if we were to get a report of somebody on the weekend that's related to a school. And we immediately follow up with that child or their family to find out really where they were, what they were doing during what we would call their infectious period, or the period of time where they were communicable, where that virus could have transmitted to others. And if that virus could have transmitted in the school setting, then we're going to follow up and get the records of who's in the class, when are they attending sort of in-person class, who is in that class, who is the teachers, who else they might have interacted with during that school day or those school days where they were infectious and at school. And it's a fairly thorough process. We'll talk to the child, we'll talk to the family, we'll talk to the school, and then we'll make recommendations depending on who was in contact with that child and who could have got the virus. And one of the big things is anybody who's labeled as a close contact. So somebody who's had a closer interaction or over a period of time with that person, they will have to go home or stay home for 14 days following their last exposure to that individual. So, and we will be following up with those. The public health nurses again will be following up with anybody who's labeled as a close contact, and we'll be following up and providing specific recommendations to them, as well as following them while they're in that 14-day period.
I mean, could close contacts, what about classmates? Could an entire class go home?
Absolutely. So I think it really depends on the actual situation, and every situation is going to be a bit different. But yes, if a child is in a particular cohort or a particular class, and that they were infectious when they were within that group, that cohort would have to, in a typical situation, that cohort would have to be what we call self-isolating at home for 14 days. So, they might be well, they might be able to participate, should be able to participate in any, school from home as able to, as the school may have set up. And then we will follow them. And if those individuals get symptoms, we would arrange for them to get tested because, of course, that could be COVID as well.
And what happens if there's a situation where there are multiple positives at a school?
Yeah. So, we hope that doesn't happen, but of course we have to be prepared for that sort of situation. And it really depends on whether there's evidence of transmission, in other words, the virus spreading in the school setting. So, you could have two individuals, let's say a teacher and a student, for example, that are not connected to one another in the school setting, that both may have acquired it out in the community somehow, and we might be aware of their exposures in the community. That wouldn't necessarily have, bigger implications for the schools, although we would manage them both separately. But if there's actual evidence that the virus has passed from one person to another in a school setting, then that's where we would be really, again, looking at the risks for the different other people, so the cohorts, and there might be several cohorts involved, or if they're in the same class, it might still be that same class, and we would basically send them home. If there was broader spread, so let's say we saw evidence of transmission and it was outside, it involved different cohorts, but maybe where we believe there was a connection between the cohorts where the virus could have transmitted, we might, the number of people that might have to isolate at home gets bigger and bigger. And there are some situations where we might have where, for example, if there are more teachers or teaching staff involved, that has a lot of implications for actually the delivery of school programming anyway. And in a worst case scenario, we could potentially close a school or have the school operate remotely for those 14-day period.
Well, I mean, certainly a lot to think about, isn't it?
Yeah, it actually is, and we're working through these kinds of scenarios and preparing for them. And I would have to say, this is a lot of this is fairly bread and butter public health stuff that we do, on a daily basis for other infections, and we've dealt with even other infections in school settings before. So it's a lot of the same principles that will apply. But it is complicated, and it certainly is quite significant.
Well, Dr. DeMille, as always, I really appreciate you joining us this morning to fill us in on the latest.
Yeah, thank you very much, Amy.
Dr. Janet DeMille is Medical Officer of Health with the Thunder Bay District Health Unit.